My mom is a pediatrician in inner city Brooklyn, New York. And as a kid, I used to go to work with her not infrequently. And seeing her interact with her patients, particularly her patients who had a blood disease called sickle cell anemia, was really inspiring. And seeing how like one gene could change someone's entire body and affect all their organs was something really intriguing. And that's actually what led me into shadowing physicians in pediatric hematology and oncology, and gave me my first lens into what it would be like to be an oncologist. And I loved it. I loved the relationships that patients had with their doctors. The doctors had these incredible relationships with the whole family, and I wanted to be part of that. I think as a lymphoma doctor, I'm super lucky that we have a lot of treatments that work very well. And so seeing patients who really were very, very sick, sometimes in the ICU, not potentially making it to the next day, but then we're able to intervene. And you see those patients leaving the hospital, going back to work, living their lives is the best part of my job. I would say the other best part of my job is I spend a significant amount of time developing clinical trials and new treatments for patients. And when one of my patients benefits from one of those studies, there's like no better high than that, to know that you were able to give them an opportunity or an option of something that they wouldn't have otherwise had the option of getting, and that really improved their disease and their quality of life. I think it's really hard to take all the anxiety away when you meet an oncologist for the first time. It's the most, if not on the top 5 scary moments in your life. And not only for you, but everybody who cares about you, your parents, your kids, your spouse. And so I usually sit down and I just try to hear their story and how they got here and their perspective. And that also gives me a lot of information about what they already know and what they don't know. And then we just talk through, what the plan is going to be and what the options for the plan are, what the goals of those treatments are, what they should expect about, side effects potentially if they're going to be getting treatment. But I think most importantly, we let them know that we're very much there for them and that there are no silly or small questions. They should feel free to reach out to us for anything. And our nurses and nurse practitioners and us are always available to help them through that. And I think knowing that they're not in that process alone helps a tremendous amount, to know that you're working with a team. It's not you're the patient and someone is just executing orders, like you're all in this together. I think Siteman Cancer Center offers a comprehensive care for patients, both with regards to their medical care, of course, but also their supportive care. We work with a team of physicians outside of the cancer center who help patients from issues like pain and cardiology and from pulmonary and neurology, and we all work together to improve the care for patients. And that makes this a really special place because every doctor that you see here is pretty much at the very top of their field. In addition to that, I think you have the options of all the treatment, the standard treatment, but also the options in terms of clinical trials, which you wouldn't get elsewhere. And many of our patients come from very far away, and we realize that that's an incredible burden on patients and families. And so we're happy to pair also with doctors who are close to home to help facilitate care. And if there's treatment that they can only get here, we help them through that for that period of time. But if we can make their lives easier and pair with doctors close to home, we're happy to do that too. All of us who are at the Siteman Cancer Center, all of the faculty are WashU faculty. We're professors, assistant professors, associate professors for the Department of Medicine. The people who are drawn here really are drawn with that intellectual drive and curiosity. So most of us do some sort of research in some realm. So I spend my time doing clinical research, where I get to take the findings that some of my colleagues in basic science have found, or things that we've observed clinically that we think would warrant further study, or learning from how other drugs work in other cancers and then applying them to our cancers, which are sometimes rare and understudied. So we do work to help develop therapies for patients and new therapies for patients, either with the goal of improving their outcomes and having more responses to the treatment or better outcomes from the treatment, but also outcomes with regards to quality of life and ease of living with cancer. It's incredibly rewarding to see your patients thrive. We have patients who have then gone on to become doctors themselves, nurses themselves, teachers, lawyers, parents, and it's exciting to share their happy moments with them. When they get married, when they have a baby, we're cheering right along the sidelines with them because, we all got through that period together. They did all the heavy lifting, but we're happy to be their support.